Unwelcome but expected, the coronavirus has hit the UK. It's inside this hospital in Newcastle, where two patients from the same family are now in isolation and being treated by specialist NHS staff. These pictures taken last year show a team in Newcastle training for this very eventuality. Dressed in protective clothing and practicing specific procedure, they're well prepared. The priority for medical experts now is tracking the movements of the two infected patients.
This is about working backwards through all the people someone might have been in close contact with, and I would like to stress that this is people have been in close contact with, not just passing in the street or something of that sort. So those are the people who we just want to make sure that if they had symptoms, we know about it early and that we're aware of the risk.
The two patients were staying in this hotel in York when they became unwell. On Wednesday, the building was put on lockdown as some family members, believed to be Chinese nationals, were taken to hospital displaying symptoms of this new strain of coronavirus. It's one which is highly contagious. There's no vaccine, humans don't have immunity, and the virus could mutate, so it's hard to control. Signs of infection include respiratory symptoms, fever, coughing and breathing difficulties, but in severe cases it can cause pneumonia and even kidney failure. Good hand hygiene is the best form of prevention. Not a word from the Health Secretary today, only a slight nod to reassure the public.
Are we safe, Mr. Hancock?
But this is a country which has been on high alert for weeks. On Monday, a man was rushed from his home in Birmingham to hospital by medics in biohazard suits after displaying symptoms. He's one of 175 people who've been tested for coronavirus and proved to be negative. The official line is not to panic, but this hasn't stopped face masks running out in some places across the UK. And for those people returning from China, not just Wuhan, who have cold or flu-like symptoms, the advice is to self-isolate and call 111.
I think it's important to reassure the public that we have a lot of experience in terms of dealing with influenza, particularly recently pandemic influenza. So our plans around managing this are very similar to those in terms of surveillance and preparedness, and then management as we move through the outbreak to support patients and the public at this time.
The world is still learning about this new coronavirus, which is rapidly spreading by the day. With 2 cases now in the UK, the race is on to work out who's had contact with the infected patients. Health officials have no idea how high that number could be. Charlotte Lomas, Sky News.